Welcome to my YouTube channel. Thank you so much for pressing play. My name is Anna Yosi, and on this channel we talk about all things modern day age motherhood. I am the mom bringing you the tea on motherhood. A disclaimer, before I start this video, I am not a healthcare professional or a registered nurse or doctor. Therefore, I am not qualified to give medical advice. However, the information that I'm putting through in this video is based from my personal experience and a bit of research. Okay, so let's get into it. So today I am talking about physical body changes you can expect during pregnancy and beyond. Okay, so first things first, I'll start with the pregnancy, then move on to after birth and some beyond changes that you can expect. Okay, I'll start with the very common one. During pregnancy, it's either weight gain. The weight gain is of course natural. It's coming from the baby and everything else that comes with the baby, and also some fat that you are gaining because you need to be able to withstand carrying this baby. So it's perfectly normal to gain weight during pregnancy. It's very common, everybody knows about it, but there is a range of a healthy weight that you can gain during pregnancy. I'm not 100% certain, but I think it's like 12 kgs. Is it 12 to 20 kgs? I'm not certain. I will put it somewhere on the screen. What is the healthy weight range you can expect to gain during pregnancy? And then on the flip side, weight loss can also be a physical body change, because depending on how your morning sickness is, or how you how the pregnancy is treating you as a mom, you might not be able to eat most foods, you might not be able to keep food down, and therefore you'll be throwing up quite a lot, which is morning sickness. Doesn't only happen in the morning. So yeah, as a result of morning sickness or being unable to just eat or not having an appetite, you might actually lose quite a bit of weight as well. So yeah, it's one of those changes that you can expect during pregnancy. The other one is hyperpigmentation throughout your body. So it's either it will be on your face, your neck, your breasts, your belly, your buttocks, and it just does not look good. I experienced all that kind of hyperpigmentation. It took a while for the hyperpigmentation to actually go away. I think maybe 3 to 6 months after I gave birth, that's when the hyperpigmentation started to clear out of my body, but on my face it was still quite pronounced. So yeah, the other change is you might develop new or different unusual skin concerns to the skin concerns you might have had as a woman before pregnancy. I have covered a guideline on addressing your skin concerns in another video. Okay, so you might develop certain skin concerns that are new to you, that you've never had. Things such as uneven skin tone, hyperpigmentation, acne. I had extreme acne during my pregnancy. I do suffer from acne, but before I fell pregnant, it was under control. When I felt pregnant, had this huge acne flare up, couldn't do anything about it, because you have to be careful on the types of chemicals and ingredients that you use during pregnancy, because they can be absorbed onto the bloodstream and onto baby. So I just decided to play it safe and just leave my skin alone. I've also noticed a few women who have extreme rash, even if it's not acne, but like the face is quite textured. So those are the type of skin concerns that might develop during pregnancy, that are new to you, or that you thought they were done and buried, and then they just come up at you during pregnancy. The other really positive one is that you might just have a really nice glow. You know, your complexion looks more even and toned, and you have that pregnancy glow that a lot of people speak about that I've never experienced. So yeah, you might have a pregnancy glow. That's a big plus. Another big plus physical change you can expect during pregnancy is hair growth. Guys, my afro when I was pregnant, the thickest. So it was like quite voluminous, it was thick, it was black, it was healthy, it was growing. So yeah, that is a really nice plus that you can expect during pregnancy. So these changes that I'm talking about, not everybody will experience. So the changes are dependent on your lifestyle, your eating habits, your exercising habits, and your genes, you know. So they determine what kind of physical changes you might or might not have during pregnancy and beyond. So the other one is common stretch marks. You will have stretch marks in places you never thought you would have stretch marks. That's all I have. That is all I have about stretch marks, guys. It happens to some, it doesn't happen to some. Apply all type of topical treatments. You're happy, then buy your oil, tissue oil. If your body wants to have stretch marks, those stretch marks will pop up at month 8. I'm telling you. Anyway, so yeah, that is another physical change you can expect during pregnancy. Not all women have it, and not all women don't have it, if that makes sense. Another thing that during pregnancy, physical change is that your feet might somewhat grow. They become a size or two bigger than they were before pregnancy. My feet did grow after pregnancy. Some of my shoes, I used to wear size 3, 4, and if it's a small, maybe a 5, but I never really wore 5. So but now after pregnancy, I wear size 4 and 5, no longer size 3 now. So yes, it does happen. I mean, it's not only me, but it is physical change that does happen during pregnancy. Let me let you guys simmer on all those changes, all those physical changes. Like, really, your shoe size changing? It does, it really does. Okay, moving on to physical changes after giving birth. Shortly after giving birth, you're still going to look like you're pregnant. It can be months, it can take months for your belly to deflate all the way back. Okay, so the other physical change after giving birth is loose skin. So not all women obviously have this, some will, some won't. So because your body stretched that much, or your belly stretched quite a bit during pregnancy, so when it deflates all the way back, you might find that your belly is not as firm as it was, whether it was flat or not, whether it had a flat belly or not. But the skin becomes looser than it was. I'll put a picture to show you what loose skin is, and it's not necessarily baby fat or fat tissue, but it's just your skin has lost its elasticity, so it didn't go all the way back. So you might have some loose skin. That is common in pregnancy, especially around middle age, and that is fine. It's normal. It's part of your body actually showing what it has gone through, what it has experienced. It's fine, it's normal. You just need to make peace with that. Okay, and the other one after giving birth is is Diastis Recti. Means the separation of your core muscles. So this also happens during pregnancy. Some women might have their core muscles meeting back together like this, but this Diastis Recti looks like this, like your muscles are not back together. So you cannot treat this, but there are certain exercises that you can do that improve the appearance of this Diastis Recti. So what happens is your muscles are so far apart that you always have loose soft tissue in your stomach, even if you are quite slim or slender and your stomach is not fat, it's not big or fat, but there will be that loose tissue, and sometimes it could look like that pouch, which is a fupa, which is that fat area that is at the lower end of your abdomen. So yeah, those are the physical changes you might expect. The fupa, that is also dependent on your weight and your lifestyle before your pregnancy, your genes, and how you gave birth. Sometimes it is quite common in women who've given birth through cesarean section. Yeah, that is shortly after giving birth. The other physical change shortly after giving birth, I think it's postpartum shedding. I experienced this like, I think 6 months, maybe 3 to 6 months after giving birth, where large amounts of my hair was falling out. I didn't know what it was. I wasn't even aware. Like, my partner actually pointed it out. He pointed it out, like, it was like, what's happening with your hairline, baby? And I was like, what do you mean? And the hair was just gone. The hair was gone and I wasn't even aware. And then I tried saving the hair. I just couldn't, guys. I just couldn't. But there are ways on saving your hair. Apparently, I've actually watched a YouTube video from Aisha in live. She said that she continued to take her preggy multivitamins after giving birth, and handled her hair with more care. So that greatly reduced the amount of hair shedding that does occur after giving birth. But I didn't have the patience. I just shaved it all off. I was tired of saving hair that didn't want to be saved. Shaved it all off, and that was the best decision ever. Saved me so much time with taking care of my son with no hair. It was actually really fun. I loved that. But yeah, I think that is one of the physical changes that you can expect. And then the beyond part. The beyond is basically your body, your postpartum body is not just about the weight gain. It might just look different altogether. The shape, to a certain extent, your body shape will appear to be different, you know. And obviously this doesn't happen to all women, but your postpartum body, even if you've tried to lose weight and you've lost the baby weight, but your postpartum body, there's something about a postpartum body that just looks different to pre-baby body that you might have to live with and make peace with it. Okay, this is your new body. You will exercise, look after it and care for it, but sometimes it's very difficult to have your body look exactly the same way it did pre-pregnancy. And those are the changes and beyond. So the hyperpigmentation does go away, but just the beyond is just the body will slightly look different, you know. That loose skin, there's very little that you can do to remedy that unless you go through an operation. I don't know what the name of that operation is. So those are the physical changes you can expect during pregnancy, shortly after giving birth and beyond. I hope this video makes you feel better about your body that has changed over time during pregnancy and beyond, and where you are. And if you don't have a child yet, you haven't fallen pregnant, don't be alarmed. You might not have all the physical changes, but it's good to just be aware and expect them and try to prevent them whichever way you think you can. So I hope you enjoyed this video, you learned a thing or two, and yeah, please share with your family and friends, and don't forget to subscribe. Camagu.